सबसे हम पहले देखते हैं हेल्थ फॉर ऑल। इसमें क्या होता है, इसमें 2000 तक WHO ये सोचता रहता है कि तमाम तरह के लोगों को हेल्थ की तमाम फैसिलिटीज़ मिलती जाएंगी, ठीक है ना। अटेनमेंट ऑफ ऑल द पीपल्स ऑफ द हाईएस्ट पॉसिबल लेवल ऑफ द हेल्थ, ठीक है ना। इसकी ऑल द पीपल इन द ऑल कंट्री शुड हैव एटलीस्ट सच लेवल ऑफ हेल्थ दैट दे आर कैपेबल ऑफ वर्किंग प्रोडक्टिवली एंड पार्टिसिपेटिंग एक्टिवली इन द सोशल लाइफ ऑफ द कम्युनिटी इन विच दे लिव। Health for all means the health is to be brought within the reach of the every people, everyone in a given community. It implies the removal of obstacle to health. That is to say that the elimination of the malnutrition, ignorance, disease depends on continued progress in the medicine and public health. Health for all was a holistic concept calling for the effort in the agriculture, industry, education, housing, and communication. But the problem in this regard was that how to achieve it. It symbolized the determination of the countries of the world to provide an acceptable level of the health to the all people. Health for all has been described as the revolutionary concept of a historic moment, a moment in the term of the own revolutionary. Next is definition of the health. What is health? Health is a state of complete physical, mental, and social well-being, and not merely an absence of the disease or infirmity. Now, what are the main determinants of the health? The main determinants of the health are communities, societies, individuals, and families. Community includes the human rights, the biological and behavior, and the environment, socio-economic and health system goes into the societies, and socio-culture and aging of the population, and science and technology goes into individuality, and families include the gender, information and communication, and equity and social justice. The concept of health development we see here, it's the concept of the health development as distinct from the provision of the medical care in is a product of the recent policy thinking. It is based on the fundamental principles that the government have the responsibility for the health of their people, and at the same time people should have the right as well as duty individually and collectively to participate in the development of the own health. Now we see what is the difference between the indicator and variables. Indicators are only indication of a given situation or reflection of that situation. In WHO's guideline for the health program evaluation, they are defined as variables that help to measure the changes. Often they are used particularly when these changes cannot be measured directly, as for example health and nutrition status. If measured sequentially over time, they can indicate the direction and speed of the change and serve to compare different areas or group of the people at the same moment in the time. What are the characteristics of the indicators? It should be ideal. For an ideal indicator, it should be valid, it should be reliable, it should be sensitive, specific, and feasible and relevant. Mortality indicators includes first of all the crude death rate. It is defined as the number of the death per thousand population per year in the given community. It indicates the rate at which the people are dying. Strictly speaking, health should not be measured by the number of the deaths that occur in the community. But in many countries, the crude health is the only available indicator of the health. Now, then comes the expectation of life, the average number of the years that will be lived by those born alive in a population if the current age specific mortality rate persists. Now next comes the most important infant mortality rate. This is the ratio of the death under 1 year of the age in a given year to total number of the live birth in the same year, usually expressed as the rate per thousand live birth. It is one of the most universally accepted indicator of the health status, not only of the infants but also of the whole population and of the socio-economic conditions under which they live. Then comes the adult mortality rate. It is defined as the probability of dying between the age of 15 and 60 years per thousand population. The disability rates. The commonly used disability rates fall into two groups. Event type indicators, for example, number of the days, restricted activity, bed disability days, work loss days, and the person type indicators, limitation of mobility and limitation of the activities. Health adjusted life expectancy, the most important name of the indicator is used to measure the health life expectancy that is changed from the disability adjusted life expectancy to the health adjusted life expectancy from Dale to Hale. The health Adjusted life expectancy is based on the life expectancy at birth, but the includes adjustment for the time spent in the it is most easily understood as the equivalent number of the years in the full health that a newborn can expect to live based on the current rate of the ill health and mortality. Then comes quality adjusted life years. It's a measure of the disease burden, including both quality and quantity of life lived. It is used in assessing the value of the money of a medical intervention. KLE is based on the number of the years of the life that would be added by intervention. Disability free life expectancy, active life expectancy, and disability adjusted life years. DALY is measure of the overall disease burden expressed as the number of the lost year due to the ill health, disability, and early death. Others are not so important. So we can see other indicators called the mortality indicators, morbidity indicators, disability rates, the nutrition status indicator, the health care delivery indicators, utilization rate indicator of the social and mental health, environmental indicators, socio-economic indicators, health policy indicators, user quality of life, and other indicators. Millennium Development Goal indicators. The first goal is about the poverty and hunger, and the second goal is about the reduced child mortality, and fourth goal, child mortality, and fifth goal improve the maternal health, and sixth goal HIV/AIDS, malaria, and other disease, and seventh goal environmental sustainability, and eighth goal is about the global participation in the development. 1, 4, 5, 6, 7, and 8. Levels of the healthcare: the primary healthcare, secondary healthcare, and tertiary healthcare. First level of the contact between the individual and health system, where the essential healthcare is provided. Majority of the prevailing health complaints and problems can be successfully dealt with this level of the care is close to people in the ओके डायरेक्ट कंटेंट होता है, जैसे मतलब देहातों में होता है BSc RSc. सेकेंडरी हेल्थ केयर में एट दिस लेवल मोर कम्प्लेक्स प्रॉब्लम्स डेल्ट विद द केयर comprises essentially curative service and is provided by the district hospitals and community health centers. This level serves as a first referral level in the health system. The tertiary healthcare, the level offers the super special care like the teaching hospitals provided by the regional central levels. These institutions provide not only highly specialized skill but also planning and management skills needed for the specialized staff. It includes the teaching hospitals. Okay. For epidemiological triad, there was a concept which is known as germ theory of disease. It was limited because disease agent man and disease, there must be some other agent which was involved, and that was not invented at that time. When this became very common in the coming time, then they made a new concept of the epidemiological triad, which involves the agent host environment. Has been used for many years. It helps the epidemiologists to focus on the different classes of the factors, especially with regard to the agents of the infectious disease includes bacteria, virus, parasite, fungi, and molds. And host offers a subsistence and lodging for a pathogen and may or may not develop the disease. The level of the immunity, genetic makeup, and level of exposure and state of health and illness of the host can determine the effect on the disease organisms will have on it. Okay, for example, many infectious diseases can all exist in the limited temperature range. Environmental factor can include in the biological aspect as well as the social, cultural, and physical aspect of the environment. Now we'll see what is the natural history of disease. Natural history of disease results from the complex interaction between man and an agent for the cause of disease and environment. This term is called natural history of disease. Natural history of disease, we have seen the very beautiful chain from the Kparks comes, in which we can see easily the period of the pre-pathogenesis and period of post-pathogenesis. Disease process, how it occurs, and before man is involved, and all the environmental factors that comes in the primary prevention, health promotion, specific protection, and then early diagnosis comes, and secondary preventions, and tertiary prevention includes the disability limitation and rehabilitations, and all the types of the involvement is seen in this till the death. Definition of the epidemiological triad comes the causative factor of the disease may be classified as agent, host, and environment. These three factors are called epidemiological. The concept closely related icebergs of disease. The concepts closely related to the spectrum of disease is concepts of the iceberg phenomenon of disease. According to this concept, the disease in the community may be compared with the iceberg. The floating tip of the iceberg represents the physicians see in the community, what physician sees in the community, i.e. clinical cases, and the vast submerged portion of the iceberg represents the hidden mass of disease, the lethal, inapparent, pre-symptomatic, and undiagnosed case carriers in the community. The water line represents the demarcation between apparent and inapparent disease. Some diseases, the hypertension, diabetes, and anemia, malnutrition, and mental illness, the unknown morbidity, the submerged portion of the icebergs far exceeds the known morbidity. The hidden part of the icebergs thus constitute all the important undiagnosed infection and disease in the community, and detection and control is a challenge to the modern techniques in the preventive medicine. One of the major determinants different in the study of the chronic disease and unknown etiologies absence of the method to detect the subclinical state at the bottom of the iceberg. We can see the diagram. What is sentinel surveillance? A method of identifying the missing cases and thereby supplementing the notified case is required. This is known as sentinel surveillance. The sentinel data is extrapolated onto the entire population to estimate the disease prevalence in the total population. The advantages of such a system are that the reporting biases are minimized and feedback of the information to the provider is simplified. There are 4 levels of preventions: primordial, primary, secondary, and tertiary. The primordial includes the new concept receiving the special attention in the prevention. This is the primary prevention in the purest sense, prevention of the emergence and development of the risk factors in the country or population group in which they have not yet prepared. For example, many adults have problem of obesity, hypertension have their early origins in the childhood because this is the time when the lifestyle are formed. Okay, in primordial prevention, the efforts are directed towards the discouraging the adopting the of lifestyle. The main intervention in the primordial prevention is the individual and mass. Primary prevention actions taken prior to the onset of the disease, which removes the possibility that a disease will ever occur. मतलब कि disease होने से पहले intervention in the pre-pathogenesis phase of the disease or the health problems or the other departure from the primary prevention may be accomplished by measures designed to promote the general health and quality of the life of the people by specific protect measures, and these are discussed in the detailed self-in mode of the intervention. The primary prevention is far more than the averting the occurrence of disease. It includes the concept of positive health as a concept, the achievement and maintenance of the acceptable level of the health that will enable any individual to lead a socially productive life, healthful. Or the concept of the prevention is not being applied to the prevention of the chronic disease such as chronic heart disease, hypertension, and cancer-based elimination. Of WHO has recommended following approach: primary health prevention of the chronic disease and population strategy and high-risk strategy. Secondary prevention, an action which halts the progress of disease in its incipient state and prevents the complications. Basic intervention are early diagnosis, screening tests, and finding programs, and educate treatment. By early diagnosis and educate treatment, the secondary prevention attempts to address the disease process and restore the health by seeking out the unrecognized disease and before the irreversible pathological changes have taken place. Reverse communicability of the infectious disease. It may also protect others in the community from acquiring the infection and thus provide at once the secondary prevention from the infected individuals and primary prevention from their potential. Secondary prevention is the largely domain of the clinical medicine. Then comes the tertiary prevention. The disease process advanced beyond its early stages. It is possible to accomplish the prevention by what might be called tertiary prevention. It signifies the intervention in the late pathogenesis phase. The tertiary prevention can be defined as all the measures available to reduce or limit the irreparable or disabilities, minimize suffering caused by the existing departure from the good health, and to promote the patient's adjustment to the irremediable condition.